We are here having a little virtual journal club. Today we're going to be discussing the new paper out here on percutaneous enzymatic chemonucleolysis of intervertebral discs that appears safe and effective in treatment of acute-onset paraparesis and paraplegia in small dogs out of TAMU and Cambridge. So that's what we're going to be looking at and just talking today. I have with me Allison Mooney, who's a fellow neurologist. How you doing, Allison?
Oh, hey, Ryan's my resident mate for those of you all. So you probably know a little bit about Gibson. I went to undergrad at Virginia Tech, but I did my vet school at the University of Tennessee. And then I did my rotating internship at Colorado State, and I matched for residency in neurology and neurosurgery at Mississippi State. So that's how Ryan and I know each other. And we are both very big fans of PubMed. A day without PubMed is a day without sunshine, as I say. And yeah, I mean, like I reached out to Ryan this morning, which we talk probably every day. And this paper keeps coming up. I've actually had a multitude of people reach out to me kind of initially when it came out, and then I kind of noticed a resurgence of people the last week, maybe?
Last week, just about. There's been a huge resurgence, people talking about it.
And I think that's great. I love talking about peer-reviewed literature. That's really important. That should be the foundation of what we do. But I think I would like to kind of talk a little bit more about the content of the paper and maybe some of the conclusions that are being reached about it that I guess to me I don't see that here. It's not just me.
Yeah, I think you and I have had the same concerns, is that like this paper represents a very early stage of this research. Very early, to the point where we don't even have FDA for use of this and things like that. And so this really early nature of this, I think, obviously people very much jumped to, well, what can we do with it? How are we going to use it? And I don't think we're at the point where this is going to be in day-to-day practice. I don't think it's there yet. I think there's a ton of questions that still need to be answered. And like I said, I think this is just the surface level of this, but it's nowhere near ready to be used in day-to-day or general practice. But I would agree. I think there's a lot of discussion going about, I get students who ask, hey, we've saw it. Are we going to start doing it here or things like that? Are you going to start doing it at the other practices that I pop in and out of? And, for me, the question right now is not outside of a clinical study. I don't think we have the proof of just throwing this into it. And I think a lot of that's, again, I think just extrapolation of the information in the write-up that's maybe be misinterpreted.
Yeah, I would agree with that.
So I think jumping into this, all in all, the group that wrote it, I mean, these are not people who are nobodies in neurology by any means.
They're behemoths, right? We know these people. Their names are very familiar to us. They're smart people that have very elevated thinking, and I'm very glad that they're doing what they're doing.
Me too. And I think that's the great thing about science, is you always get to start small and work your way big. I just think, as we've talked in the last 24 hours, we have to be careful about what is the message getting out there.
Yeah, very careful.
So looking at this, really, for those of you unfamiliar with this paper yet, it comes out and it really starts talking about the use of basically enzymatic breakdown of discs after a disc herniation. And they're really aiming in on that population of animals that can't afford the imaging and the surgery, which, as someone who spends a lot of time doing the consults in that space and working in that space, I love that idea. However, looking at this, one of the big things that I have to question, because this was kind of a phase 1 study, and so, yeah, it needs a lot more work. But I think one of the biggest limitations that I found was there was very little comparison to traditional just medical therapy.
Yeah. So, and also I just want to kind of like be a little bit specific, because I think that if you don't read this paper, this part gets lost. So this material that they are injecting a substance, they're actually injecting it into the suspected, the presumed intervertebral disc that is causing the problem. They're not injecting it like into the canal where the material would have been extruded and then have thus like kind of been causing the problem either via kind of like those the primary mechanisms of spinal cord injury, right? The physical compression of the material. And then certainly, of course, there's that secondary injury that
Yeah.
can burn you. But so this material was not injected into the canal just to be clear. It was
Yeah.
injected, you know, into the intervertebral discs. Um,
Yep. And they did it under sedation
they
and
did it
fluoroscopy.
and they used fluoroscopy and something else. I don't think we necessarily need to go into the numbers of dogs that were included. I mean, like, for numbers in veterinary medicine, honestly, it was a reasonable number. I felt like
I thought so too. I was like, actually, for vet med, pretty
it's
good.
not bad. I do want to acknowledge they excluded French bulldogs, which is very important because that's a huge percentage of
Huge
my
percentage of the dogs you're seeing.
patients that I treat. But while they did things and they selected their cases, right? They made sure that the animals were less than 15 kilos. They weighed anywhere between 2 and 10 years of age, or sorry, they were anywhere between 2 and 10 years of age. They did not diagnose these dogs via cross-sectional imaging in any way. So it was very much so presumptive diagnosis.
Yep. And so just a quick couple summary takeaways. One, this is not an injection that goes IV or intramuscularly. It's getting and going into the discs. So this is not something that I would anticipate for any, for general practitioners to pick up real quick or right away. And I think that was something that people were talking about was, oh, so now my general practitioner can do this. Well, unless they're comfortable putting needles into the intervertebral disc space, probably unlikely, right? Especially as we learn and we use fluoroscopy. And yeah, you could use a table to meet some of those objectives. I don't see it rolling out too quickly. But again, we have a lot of steps before we even get to that part of it. And then the second summation I want to make was your discussion on the bulldogs. And it's interesting because they had 3 bulldogs and they said, ooh, we actually stopped because of the respiratory distress.
Yeah.
And I was like, yeah, I don't blame you one bit. And so,
and I think that another paper, I'm not trying to like go off on tangents. I think there's another paper that came out of TAMU right before this one that also excluded French bulldogs, where they looked at just like medical management for dogs straight up, like no intervention. And it was like, hey, a lot of them do really well was kind of at the point of this study, but they also did exclude French bulldogs from that study.
They did, yeah. And I don't know that we can be doing that and saying this is how it's going to change neurology right now.
Or it would have to be a very like almost breed specific or breed exclusionary.
Yeah, and this was heavy dachshund.
Very heavy dachshund. So like you could make, like if you want to say, okay, like they didn't do cross-sectional imaging, but these were like the vast majority of them were dachshunds. Okay, fair. I hear you.
That is, that was the one thing I saw is like, you know what? At least of the population, I can get behind that. Whereas like I think I struggle when like with cutaneous trunci, it is my least favorite reflex. And again, in dachshunds, and actually, it probably is the one breed I trusted the most. But you get into some of these French bulldogs with their like weird thoracic spines.
Yeah,
I don't think you can again use this without imaging in a French bulldog.
Why Ryan's bringing up the cutaneous trunci is that is kind of where, since we didn't do any cross-sectional imaging, right? So we didn't diagnose these dogs officially, but we also didn't truly identify where the suspected disc herniation was. So that's why when Ryan's talking about using a cutaneous trunci, they were using that to kind of estimate the level at which the intervertebral disc was causing the problem, right? That, and like what Ryan's saying, the cutaneous trunci is just, she's fickle sometimes. But that's also why they didn't just go at the level of the cutaneous trunci. They kind of went in that general region around it, and they inserted the substance kind of into multiple. What was it? Was it 4?
4. Yep.
4 intervertebral discs that were kind of consecutive, like around that area. So that was kind of their way, I think, of being like, okay, it's around this level. So that was bothersome to me, not having a diagnosis, of course. Using the cutaneous trunci that we know is kind of not always the best. Like, we're not going to go and cut off of the cutaneous trunci, right? Like,
Yeah. And I think one for me, and I can get behind, it's like, okay, they use dachshunds. They had to have the cutaneous trunci there to do it. I can get behind some of that. I think my biggest concern, and I know that there's not a lot of support for degree of compression and how it does,
mhm.
but, there wasn't really any discussion on, do we need to know how much compression there is to talk about the dose that's required?
Yeah, yeah, yeah. I never even thought about that,
Yeah,
honestly.
so I think that that's a whole nother discussion, right? Is like, is this approach great for a less than 50%? But we
Yeah,
also know that like dachshund compression is a lot different than French bulldog compression.
way different, way different, way different.
And so that was one big limitation that I saw. Because again, I too can get behind the like, okay, likely presumptive, but again, for an academic paper, I was actually surprised that they didn't at least do that. And again, I understand and can appreciate the premise on which they're basing that.
Mhm.
But I think early on in such an early phase of this research,
Like, if this is going to be a phase, what a phase
this was
one,
phase one.
then
Yeah.
that should have been. I guess I don't know that you can call it a phase one. It completely. I don't.
Yeah,
It,
because the efficacy part of it is we're just basing it on that. And again, I probably would have leaned a little bit more towards a pilot study because there wasn't a lot of
I,
dose discussion,
yeah,
but
I think pilot study, and I think pilot study is also more appropriate because you are also this. There was not a control group in this study,
which
right? Like,
there wasn't. And I don't know, I can't remember if you need one specifically for a phase one technically, but I think there's so much data out there for conservative management that was not discussed in this paper,
no,
other
and
than their other paper.
yeah, right, right.
I was
Literally,
like,
the
yeah, I
paper.
was like, you can't be the authors of the other paper you're comparing to.
Yeah,
Because there is not that I think that these individuals have a bias, but there are so many other papers on medical management.
yeah.
Then why didn't those get discussed and thrown in here as well in terms of percentage recovery rates, times, things like that? Like, I think we could have compared this at least retrospectively to a lot of papers. Um,
And I also think they could have just straight up given half of these dogs a placebo and half of them the material. Like, I think that would have made this stronger.
yeah, and I anticipate that that's their goal as they move into like a later phase, at least in reading some of these limitations. What I think is really important for people to know is this is not completely brand new. This was actually reported out like back in 1997 was the first time this was used.
Mm,
And there's it starts making you wonder, like in those papers in the paper out of Japan, why hasn't it caught on?
I don't know.
And that makes me suspicious of it. And again, maybe it's that it was inappropriately being used. Maybe we have to, look at that. Maybe the dosing was too small, right? I think there's a lot of discussions and I'll be honest, I haven't dived into the Japan-based papers that talk about some of that, but this isn't brand new. This has kind of
Yeah.
been around in terms of utilization. They've used it for other type of disc herniations and things like that before. And again, maybe it's just that it needed the time and needed the support to get to this level.
Yeah.
Because we know that medicine is very slow to move forward.
Yeah.
Very slow. Um, Interestingly, the one comment that was made in this paper that I don't know, in my gut made me feel I didn't like it. It was that non-surgical treatment is widely considered to fall short of the standard of care. I feel like medical management is still a standard of care.
It's still a standard of care. It's just having a safe and appropriate case selection in order to be able to make that recommendation.
Yeah.
Yeah, I don't think that that's a fair.
It really kind of made us seem like, oh no, we only are going to determine surgery. And I'll be honest with you, I feel like it's half and half. When I'm on clinics, it's like, well, half of them will do it, half of the clients won't.
Yeah.
And for me, I don't have any bias against those that don't. Matter of fact, A lot of the ones that are walking, we're like, please don't. Like, let's give this medical a
Seriously, because
shot.
we don't wanna no, why would we that doesn't make a lot of sense. I mean,
Yeah.
like, I agree. I think it almost felt, and maybe this is just my feeling of the paper though, that it was kind of like, I wanna say anti-surgery, but that's kind of almost like it made it feel like so much of us are kind of like pushing that, and I don't think that we necessarily are.
No, I don't think anyone's taking a dog to surgery just to do it. And yeah, it did have like kind of this anti surgery vibe, and I'm all for having more tools in our toolkit.
Yeah,
Like
if we can
genuinely.
help more pets and
Yeah.
not, like, cause major financial disruption to people, like, that's how is that not a good thing?
Right.
But I just I just want people to be careful when they're looking at this paper.
Yeah.
I don't think that you need to making those sweeping assessments based on this paper, because all I think that was proved by this is that a lot of dogs get better with rest. I don't think that you can say it was necessarily because of this
Yep.
enzyme. That is how I feel, and
Yep.
that's not just how I feel. I mean, I think if you really actually sit there and evaluate the data, I'm not sure that anybody else can think that too.
No.
Uh,
This paper gave me, and I it gave me very strong, all those papers that came out maybe a decade ago about stem cell use and injecting that
mhm.
epidurally, or, it's giving me those same vibes
Yeah,
where they were coming and saying 95% of the dogs got better. They were going to get better. Like,
it's like you were, and I do feel like he make a comment about that though. Like I
he
think he
does.
also acknowledges somewhere in the
In full
discussion where he's
disclosure,
like,
they
hey,
did say that.
yeah, like this could just be that some dogs are just going to get better. So like shout out to them for acknowledging that, but also like
Yes.
that is our job as veterinarians to not gloss over that part,
Yep.
and to not just look at this kind of shiny new potential treatment, and start cherry picking pieces of a paper,
No, we like.
and a study to support your narrative.
Yeah. No, I would completely agree with that because
That's true for all. I'm not going to get into it at
yeah,
all treatments. I'm not going to go there. Everybody knows how I feel. But that's true of a lot of medications that have recently come out. Um, so
agreed. And that was my big takeaway is like, so one, we don't have any information in the number one dog we see in neurology.
mhm,
We don't have a great comparison, even to the literature of conservative management in terms of that discussion. And I think, like you said, as you get into that, I think it would probably be not, statistically insignificant of a difference in terms of medical management, just putting them in the cage, which I would argue is even cheaper and safer than sedating them
right,
and doing this.
right,
And we already do that, and
yeah,
I argue that if they really feel like that is such a bad low standard of care, which I completely disagree with,
yeah,
I think we need to change the narrative of conservative and medical management.
yeah.
Because if there are neurologists out
Agree.
there,
They're not like whisking you away to surgery, and I don't know if some of that is something that we have perpetuated in our field, that like we are so like cut happy or something.
yeah,
I also have been reflecting on that some, but like,
and I think that's fair because I've heard other neurologists say if you're not going to do the workup and the surgery, don't come.
which is
And
it, that's gross,
it
right?
is it is very gross, and I would have to say that is some a little bit of a tisk tisk to any of our colleagues who think that. And I mean, maybe it's because I want to serve that population of people who don't have money. I mean, that's why I do all these virtual things and travel a lot and try to help general practitioners feel more comfortable with this neurology stuff. But I don't know, to poo poo on anyone who wants to do medical management, but also have the benefit of our knowledge and experience with disc disease. You're right. It's just gross. And I think
I
there's
mean,
no
like,
other ways to do it.
and it's a bit of a tangent, but I always say you don't need $5,000 to come and see me and have
Nope.
me look at your pet. And so I just kind of want us to. I don't think this treatment is going to like release everybody from the benefits of referring these patients to neurologists. I question whether or not it's going to take the place of medical management. Time will tell with more
Yeah.
um, traditional medical management. Sorry, I guess when Ryan and I are talking about medical management, that means activity restriction and an anti-inflammatory of some variety, and then it's kind of a little bit of dealer's choice as far as additional analgesics, right? So
Yeah.
pregabalin versus gabapentin, maybe a muscle relaxer. I use a lot of Tylenol.
Yep.
For dogs.
And one would argue that, a criticism, right, of people who criticize the paper is like, oh, you all get paid to do surgery.
Right.
Fair. But I would argue that this now is a midline procedure that maybe now people who maybe only can do medical management, you could bring them up and do something a little extra. And
Yeah.
so you would think that a lot of neurologists would actually be a fan of this because it's an extra something
Yeah.
that can be done. And again, I think there would be cases that don't get surgery
Yeah.
because of this. But again, I think we are way too early in the process of the development of this as a true blue medication. But I think this is a good first step. And I think
Do you think they proved that it was safe? Because they also said that they proved that it was safe.
so. That actually, I love that you started to ask that question because I wanted to ask you a question based on that exact question, and that is, they had 4 dogs out of 13 develop myelomalacia.
Yeah.
If we're putting more product into the disc, is there a chance that this pushed more material or disrupted a blood clot and caused any of those dogs to further progress?
Oh, yeah. I don't know.
I don't know.
I would love to hear the author's thoughts on that.
Yeah.
Like
I think it's, I mean, yes, it's not like we had dogs that were. Now, I will say we did have one dog that developed myelomalacia that was in the uh, group that did feel their hind legs, and then one that eventually got loss of deep pain perception. So we had 2 that progressed
mhm.
in the group that felt their legs. One did not recover and then ended up going to surgery and was removed. And then there was one that was lost to follow up. And I don't know if they got the data that he started walking for 50 steps before he was lost to follow up. That was the one I was like, should this be 37, not 38? They didn't really describe that well, and I wish they would have dived into that dog more. But yeah, that was one thing I was like, ooh, because it's, and again, 6 units is not huge by any means. But what if one of the other discs that did get an injection that wasn't yet herniated?
Yeah.
In the deep pain negative dogs, we do see that. And so again, I would also like to see this head to head in a deep pain negative group control, deep pain negative treated, conservative management, ability to feel control group, and group. So, at least 4 groups at least
Yeah.
of dogs. I think the benefit of imaging the dogs in the future, what other indications should there be that we shouldn't do this, that we need decompressive surgery?
Yeah.
The length of it, right? And they even talk about, and again, another starlight for them, they talked about the French Bulldogs being so hemorrhagic in nature.
Right. And just this kind of like explosion of discs going everywhere. So like I understand why they eliminated them. To me, I don't think it necessarily was just from respiratory stuff. I feel like
Wasn't going to be as effective maybe in that breed.
that's what I question whether or not anything we do for that population in regards to the intervertebral disc, would it be as effective? And so I wonder if it actually would have skewed. I'm not trying to again like talk smack, but I wonder if they had like included those dogs in here, if they would
Yeah.
have had such good results. I don't know.
No, and I wonder the same thing. And I think certainly as a neurologist, as people who treat these, I think we have to ask that, right? Like, we see this population. We know this population of French Bulldogs they just don't do as well. We know that they're ruining the stats, right? Like, if
Yeah, man, throwing off my numbers.
throwing up the numbers, right? But I think there's so much proof of that now that I think we're all comfortable saying this is just the breed is just more sensitive. They hemorrhage more, they go down harder, they maybe, maybe their cords aren't as like, because I never seen a dog.
Yeah.
I never seen a French bulldog walking with like 80% compression, like we do these dachshunds. And you're like,
Right.
how are you walking, man?
How are you doing? Okay. No, the
Yeah.
safety, but even like from a super basic standpoint, I didn't see any lab work. Is there any lab
No,
work that we did that since?
not
And,
that I saw. No, and you raise a great point. Like,
nitpicky, but like, if you didn't check before and you didn't check after you gave the medication,
how can you say that there aren't? No, I think that's a really good limitation.
And you don't look for stuff, which we have seen in a previous study with a very well-known drug these days. When you don't look for things, it's very easy to say it didn't exist and that it wasn't a problem. So, and maybe that's just something that me not being familiar with the previous studies that were coming out of Japan, like maybe they already looked at that. I don't know, but
yeah, but you think it would need to at least, well, because do we have any complications with the sedation?
Yeah, like I mean,
issues
like putting a dog, like I don't know.
I don't know. And maybe again, I'll recognize our bias in the world of specialty medicine. We get the benefit of always, getting to do blood work before even sedation, right? But you have to wonder, right, if we're really going to say it's safe in this procedure, because this isn't just about the drug, right? This is about the procedure as well. If the whole kit and caboodle's safe, you're right. In the start and early phases, it would have been nice to have that. And again, I'm hoping that with the phase 2, phase 3, maybe a repetition of phase 3. Sorry, phase 1, or at least maybe in more expanded version.
More funding or something, and they can include things.
Can do more stuff like MRI, and recognize MRIs are expensive, so I totally get because I know that some people think that academia we can just throw things in to the magnet and give stuff away for free, but most of us that are in academia are associated with state schools who legally aren't allowed to give anything away for free and have to meet certain market values and things like that. And that's well beyond my knowledge base by any means of the academic side of academic hospitals. But I think the other thing that I will say, at least I think these authors did a decent job, minus the not talking about blood work, in regards to a lot of the limitations of this.
They did. I mean, like, I think that they were forthcoming and recognized them. It's just that it didn't seem to me reflective in their overall conclusions that were drawn. And then also some of the amplification of this study, I think, has not, for the lay people, right? For lay people.
And I would say, and even looking at some of the articles or, potential social media posts, like I do think we've kind of ignored the last page, that page 6 of the study.
Yeah.
Talk about the limitations that the authors wrote, right? This isn't even you and me coming at them.
No.
They did this. This is them.
Yeah.
They noted, right, that one, they very much said, this is an early stage. It's not FDA approved. They had to go through IACUC. They had to use this based on MDUCA. Like there was a lot of things that they set up in here that's not getting translated out because we don't even know the cost of this down the road by the time it goes through FDA approvals and, all of that. So that was one thing that they talked about. They talked about the limitation of French bulldogs and the hemorrhagic nature of those discs and how excluding them, nobody knows what that means.
Yeah.
I was interested how much they talked about the fenestration procedure.
I think I actually had to, we talked about this during our journal club. It was the first journal club for the brand new interns at my hospital. And it was me and one of our radiologists are kind of like revamping and trying to redo it. And I was like, we're doing this paper. But yeah, I don't know.
Yeah, it was just interesting because that fenestration paper, really they went in and only fenestrated and pulled it out. Again, it was, I think one of the authors at least was on those. And they said they came out again. I was like, well, if that had the same approach as this, why aren't we all just doing that?
And that's, I guess, what I was kind of like, I briefly lost my train of thought. I was thinking about whether or not my kid was going to be like, no, on his nap. But, I also think, yes, right, then why didn't we all just keep doing that? But also, I don't think, I guess to me, and maybe this is because this was written for like mostly specialists or whatever, I guess, but not even specialists. And any of us should be able to read this. But like, if you
Mhm.
didn't know that that was something that used to be like recommended as treatment, just like fenestration, right? Not like fenestration is not the same as decompressive surgery, and I would like for people that not necessarily, anyways. I think a lot of people maybe don't understand that, and I guess to me it was kind of a strange. It felt strange to bring it into this paper, that discussion about fenestration. I was
Yeah.
kind of like, "Wait, what? Why are we talking about this?" And like, I guess I think I understand why they did, maybe. Um, but I
Yeah, I
just
think
it's confusing. It was a hard train of thought for me to follow to some extent. And I think if you didn't know or understand that, like I had to be the one to be like, hey, this is like what they're talking about.
yeah, because they weren't even talking about fenestration in surgery. They were talking about fenestration as the modality of care. And like I said, if and just that way, just to be clear for anyone who might be listening and saying, "Oh, wait, yeah, you guys fenestrate." Yeah, we do sometimes. Uh, in surgery,
Sometimes not getting into that right now.
that's a whole nother that's a whole nother can of worms. But this is a fenestration procedure that goes in and actually is the procedure for this. And again, if that was really good, why isn't it being done all the time, right? Because it's still going to be surgery, it's still going to be anesthesia, all of these other things, right? They talked about their small numbers. They were very upfront about that. The one thing that I thought, in my opinion, that they could have done a better job discussing their limitations was when they started comparing it to the conservative therapy. They only cited a previous paper by them.
Mhm.
And that was one thing I was like, ooh, guys, there is so much information out there. Even if you don't like the studies, there's a
Yeah.
lot of information on conservative
Well, and you know
therapy.
what it made me think? All I could think was, and I don't remember who told me this. It might have been somebody at UT, for all I know. I don't know who said this, but they were like, you can find a paper to support you can find a paper to support anything, right? That's kind of what it made me feel like. Once again, kind of cherry picking things, and
So, and that's,
I,
I think that just would have made this stronger if they brought in a lot of that other stuff and said, hey, here's how this compared to the retrospective. Because you don't even need a control group, theoretically, if you just talk about all of those dogs previously,
yeah,
if you're going to use this as a stage one
yeah,
before moving to a control group, non-control group type approach. So I
yeah,
would have liked more on that data, especially with the ACVIM consensus and the back there. I mean, they made it really easy to make some of these comparisons.
yeah, I know.
I love that they talked about the alternative therapy the alternative reason that we already talked about, in terms that it wasn't the fact that these dogs were just going to get better because they were treated conservatively. I think
Right.
that's, for me, the biggest concern, right? And I think you and I have talked about that before. If they don't have a control group, a lot of these conservative managed dachshunds, especially, are going to walk again.
Yeah, they'll be champs.
Yep. And I tell people all the time when they come and say, "Hey, I don't got money for it," I was like, "Then please don't euthanize. Like, here's the parameters that I recommend
Yeah,
euthanasia, like
right.
progression, signs of
Intractable
myeloablation."
pain. Yeah,
Exactly. There are certainly indications. This is me not saying we should never consider that as an option, but a lot of these dachshunds are going to get better at medical management. So I at least appreciated that they did that, and I really liked how they talked about it. And they didn't talk about comparing it to disc ablation surgery, which is a preventative modality.
yes, yes.
But that was kind of one thing that they threw out there, was like, well, maybe we can go in and pre-autolyze these. And so,
To me, that's actually what I thought was kind of one of the cooler. That's where my head went with this, was like
yeah,
as a truly like a preventative measure, especially
yes.
like you're on dog that's on like, I'm not exaggerating. I've taken some French bulldogs to surgery 4,
Yeah.
5
I've done 5 surgeries on one dog.
You get to the point where you're like, okay, this is great. I mean, like, even before you get to that point, obviously, like, but
It's a
that could
3 year, like,
be a really good use. So, yeah,
yeah.
I'm glad that they talked about that as well.
If you had asked me, like, where do you think this falling in the future? I think if we're going to say, okay, we don't want imaging, and we don't want this, I think that location, that preventative approach, because we're seeing laser disc ablation surgery kind of pop back up again. It was a big topic at DECVM again this year. At least there was a lecture about it. So we're seeing it kind of go through its phase. And I think I'd love to see it put head to head against that and then a group without. So I think that was great. And again, it's interesting. I think there's a lot of questions. There's a lot of what ifs still in this. And like I said, this all in all, I think this is a great maybe first step. Again, I think the approach they took, I'm more like, oh, this was almost more of a pilot study. It didn't quite have the depth I wanted for efficacy and safety, which is
Same.
what you have to, which is what phase 1 trials are about, is safety and efficacy.
Same.
I just didn't feel like it reached that bar. And had they done blood work, had they done MRI, I could have got behind the phase 1 safety and efficacy study a little bit more. Woohoo! Whereas more, I'm like, oh, this is more of a pilot type approach. But again, I think all in all, there are significant limitations to this paper in terms of how do we apply this to day-to-day practice.
Yeah, and I think we all need to it's very easy to get excited about something, especially when it is getting hyped up on the interwebs, by social media. You know, we have to kind of stop and take a step back and like seriously go and read the paper. Don't go and read a write-up that somebody has done and let that be your only source. You know, go and read the paper. And the crummy thing is that so many of us aren't comfortable with that, right? I mean, like, it is not a core skill that we are taught in most schools. I think UT did a really good job of it. What up, good balls? But
yeah, no way.
I mean, I want us to feel comfortable critiquing these things and not like come at each other for raising questions or concerns when we do. You know, that's what's made me very reticent to kind of comment on some of these things, because people just get nasty if you have a differing opinion. And I just sit there and I say, hey, hold on. You know, it's not just me. Like, actually, multiple surgeons have read this paper where I work. And everybody's having the same kind of perception and questions to it and saying, I don't know that you can make these conclusions based on the data that you've provided us with and the way that the study was conducted.
Yeah. And I think one of the biggest things that the disinformation part of this, right, is the injections, the outcome, and just the ability of this to show up Monday next week. And
we don't even have
neither
access to this. The system, it was made somewhere, we don't even know. Like, it's not it, and it's, gosh, we just have to be so careful about amplifying this stuff, because our clients are going to come across this, and then we're already kind of having to have these conversations, at least me and some other people, about this paper, and they're asking us why we're not doing this, why we're not immediately recommending this, and then having to go and kind of like rehash all of the information in this paper that's really science forward and trying to break that down. It's challenging. But also, I think there's so much distrust right now, and it is growing, unfortunately, with medicine, just in general, and research. And so we need to be careful to not shoot ourselves in the foot in that way, and by almost like unintentionally doing that, I think.
No, I think that's fair. And I think that's one thing that, while this is great information, putting it out there, we have to recognize how early in the process this is, because otherwise it does make it seem like, oh, you guys are out to cut and you want to do surgery because you make more money. And I'll be the first to tell you that my salary is exactly what it is, whether I cut or not. I'm not in private practice. So doing less, realistically, right, like, is not doing more or doing less doesn't change my intake financially. And I have a strong, hopefully validated passion for cost-effective measures. You know, I hate that my parents can't afford or could not afford to come see me. Like, that makes me feel horrible.
Seriously.
I love being in this spectrum of care. I've developed a whole curriculum around spectrum of care, making sure we're having these conversations about
Yeah.
appropriate new therapies, how to read information literacy, and how to read these papers. And I think that's really for me what we have to do so that, any veterinarian can come out and read this paper and say, hey, cool, I saw it, I read it. Here's the limitations. Here's why we're probably not going to see this on the market in the next 2 years. Um, but it's a great first step.
Yeah.
And we can certainly keep our eye out for clinical trials if your dog goes down.
Yeah.
But
That's
I think we just have to recognize where it's at.
yeah. And I agree. I would love to see us do more in school, postgraduate, when you're out in practice, like almost CE type of thing about how to read
Yeah.
these journals and how to like take this information, truly critically evaluate it, right? Um, and then like also like ask questions like of your drug reps, right, that are coming and talking to you. Because a lot of those studies you don't have direct access to immediately, right? It's like proprietary
Yeah.
information. So like we need to empower ourselves to know the questions to ask, um, so that we can really be um, making these recommendations with like eyes wide open.
Yep. Yep. And I think that makes people such stronger veterinarians is when they can
100%.
talk about it, talk about the pros, talk about the cons, and really deep dive into it. And I realize that time is short. So hopefully people enjoy listening to our conversation, at least to get a sense of
Yeah.
what's going on. And
And go
and
and read it for yourself. And
yep,
maybe you all will like disagree with us, but the important thing is like go and read it. Go and look at some of the stuff that's out there. Like there's a lot in human medicine about like how to read an article, the hierarchy of evidence, things that have like you know, um, the lowest amount of evidence that you can trust, and then like the other types of studies, right? Those big meta-analyses that like, God, if you can get through one, go you. But also like, those are the things you can trust compared to like a single case report, right? And so getting comfortable and understanding that, um, it's just gonna make you that much better. So go and try it.
yep. No, one of the first things I tell the students in my new information literacy course, just because something's published doesn't mean it's going to change the world. It doesn't mean it's accurate.
No,
It's just a
no.
snapshot in time on those variables, and so you have to be able to read between the lines and really make a decision for you. Are you going to do it? And I look at this paper and I say, hey, you know what? If they want us to be part of a clinical trials, that's one thing. But if I'm going to go and just start doing this, I'm not. I don't think it's there yet.
No.
And I think it's many years from being there outside of a clinical trial.
Yeah.
And I think that's the big takeaway. And that's the big thing that we need to make sure of, and that we have not proven that it's more effective than conservative management. That's
Haven't.
for me. I'm not yet convinced. Again, great first step. I hope that they keep working on it so that we can continue these conversations.
Me too. Don't hate me. Don't
No,
hate
no,
me.
no. I think really, I think that's the beauty. Really great scientists know and want to be discussed without the papers. And I
Yeah.
think when they publish anything out there, tell me if you agree or disagree. I think that's the beauty of science is, hey, here's what we found. Here's what we did. Let's talk about it. I think that's science, right? That's research. And the fact that we can be okay with it changing down the road.
Yep. And I
And
mean, that's kind of like that's literally what happened with all of those studies that looked at the durotomies, right? Everyone
yeah,
got so excited about durotomies again. Oh my God, it's going to be amazing, blah, blah, blah. And then it's like they came up with a study and they said, just kidding.
just kidding. Yeah, that was good.
So it's like science is to some extent cyclical. I think like a lot of stuff comes back around, and it should be because then we're revisiting those topics and maybe we're tweaking them, or we're using that information to kind of explore a different avenue that's like a tangent. So yeah, I hope people watch this and realize had a lot of composure